Well, Dr. Kohli, it's great to see you here.
Good to see you, Danny.
It's an awkward topic to talk about, but I want to talk to you about it. It's a really important one. I want to have the sex talk with you.
I love it, and I think it is so important for us to talk about
Good,
sex.
good. And I want to talk specifically about what's happening in the elderly community. It sounds like a lot of the elderly community right now is getting a little busy. Tell me about this and why this is something we need to be, cognizant of.
Well, it's interesting. We sort of tend to think of our older community as not being sexually active or not being interested in sex. But what the data tells us is that 40% of Americans over the age of 65 are sexually active. And a lot of this is as a result of the fact that we now have medications to treat vaginal dryness, which can happen after menopause, erectile dysfunction, which can happen in older men as well. Yeah. So we've sort of gotten over many of the age-related impairments to being sexually active. And there are a lot of dating apps out there, actually, for seniors that are really making it easy for seniors to start having more sex.
Interesting. Okay. And I mean, we love this for our elderly community. I think this is so wonderful. But what do people who are older than 65 years old need to remember or maybe even think about or worry about when it comes to having sex that age?
Well, it's good that they're getting out there, that they're being sexual, they're being physically active. But the concern is that the rate of sexually transmitted infections in our older Americans has actually doubled in the last decade. And the CDC issued all this data to sort of raise awareness of the fact that our seniors are having more sexually transmitted infections, chlamydia, gonorrhea, syphilis, genital warts, a whole host of infections. And I think, Danny, there's two kind of main reasons for this. The first is really education.
Okay.
So when our grandparents' age were younger, the biggest concern with sex was pregnancy.
Right.
It wasn't as much about sexually transmitted infections. HIV wasn't even an infection when they were in their teens.
Yeah.
And so the education around having safe sex and being protected and watching out for sexually transmitted infections is lacking. There's a barrier for older adults to talk to people about it. In fact, if you ask them, 17% of them say that even if they had issues with their sexual health, they wouldn't talk to anyone about it.
Interesting.
And then our immune system changes as we get older. So our immune system gets a little bit weaker, a little less aggressive, so we're more sort of susceptible to infections as well.
Okay, yeah. I mean, things that we need to be thinking about. Now, are there ways that, our older community can protect themselves? What can they do to make sure? Because like you said, they might not be thinking about doing things like using a condom or things like that because they're not worried about getting pregnant. What can they do?
So I think safe sex is incredibly important, and I think that starts all the way at the beginning from choosing your partner. So really normalizing that conversation around sex. If you're going to have multiple partners, especially, but even just for a single partner, who else they might be sexually active with, because remember that old saying, whoever you're sexually active with, you're active with every one of their partners as well. And so it's really important to have the conversation about, especially nursing homes and places where there's sort of closed communities where, people are being sexually active, that you're having that conversation. Using barrier protection is really important, and not for pregnancy, but for protecting yourself from risk of sexually transmitted infections. So using condoms and such is really important. And then talking to your doctor about your specific health problems, especially conditions like heart disease, for example, and what precautions you might need to take.
Yes, and I want to bring that up quickly as well. I mean, you're a cardiologist. We want to talk about the heart too. Obviously, being active like this could potentially pose risks when it comes to heart disease and just your heart in general. So what do people need to be thinking about?
So sex is a stress test on your heart. It raises your blood pressure, raises your heart rate. It's a physical activity.
Sure.
So anyone who has any kind of heart disease, whether it's heart attacks and strokes, whether it's congestive heart failure and arrhythmias, even high blood pressure that's not treated, and you go on to have sex because it can really raise that blood pressure, pop open some blood vessels, can be dangerous. So I would say if you have any chronic health problems, having the sex talk with your doctor, bring it up because they want you to bring it up is really, really important to make sure all those conditions are treated. You may even need to get a stress test, which is a test on your heart to make sure that you're in good shape before your doctor clears you for sex. And I have this kind of conversation with my patients all the time because they're heart disease patients.
Right.
After bypass surgery or after heart attack, how soon can you start having sex again? But important to talk about it so we can do it safely.
Definitely. An uncomfortable conversation potentially, but an important one regardless. Dr. Kohli, thank you for having the sex talk with us today. We appreciate it.
Sure.
And make sure to email us your questions for Dr. Kohli. Just send your message to mycoco@9news.com and put Kohli in the subject line.